Good morning students. Today we will see some of the key reasons in medical nursing. So the first question, liberal intake of fluids encouraged for a patient after cystoscopy. What is a cystoscopy? Cystoscopy is an invasive diagnostic procedure that allows direct visualization of urethra, urinary bladder and urethral orifices through a transurethral insertion of a cystoscope into the bladder. So what will happen? A cystoscope inserted to the bladder, because bladder we consider as a sterile cavity, and insertion of any foreign object into a sterile cavity will cause infection. So the bladder is irrigated through an irrigation system attached to the scope. This irrigation fluid helps bladder visualization. But the means when we intake a lots of fluids, these fluids will help to flush the bladder to decrease the amount of bleeding, and as the liquids will help to flush the bladder, it reduces the risk of infection. So there are two reasons why the liberal intake of fluid encouraged for a patient after cystoscopy. The first one, it will decrease the amount of bleeding, and secondly, it will flush the bladder so that it will reduce the risk of infection. Second question, the pulse rate should be checked before administering digoxin tablet. What's a digoxin tablet? A digoxin is a cardiac glycoside medication that has been used to centuries to treat heart failure. It has three effects on heart muscles. That means first, positive inotropic effect, that means increase the contractility, stroke volume and cardiac output. Second, negative chronotropic action, that is decrease the heart rate. So we are concentrating on the second effect of the digoxin, that is negative chronotropic action, that means decrease the heart rate. So if we give to a patient whose heart rate is already decreased, then it will again decrease the heart rate. So apical pulse should be taken for a full minute before administration of this medication. If the apical pulse is less than 60, the dose should be withheld and prescribing provider should be notified, or the doctor should be informed, because if we give it to the patient whose pulse rate is less than 60, because of the negative chronotropic action, the digoxin will again decreases the heart rate. Sometimes the patient will go into a cardiac arrest. So the pulse rate should be checked before administering the digoxin tablet. Intake and output chart should be maintained for a client on diuretics. What is the importance of intake output chart? Intake output chart is used for the purpose of documenting and sharing information regarding, first, whatever fluid is taken by the patient, that means either via gastrointestinal tract or through intravenous route. Secondly, whatever is excreted or removed from the patients. A diuretic is a substance that promotes diuresis or the urine formation and increased production of urine, and this includes forced diuresis. So monitoring a patient on diuretics is necessary to assess the response to treatment and to prevent adverse effect. What will happen if there is more urine formation? It may cause electrolyte imbalance and decline the renal function. So monitoring of a intake output chart for a patient on diuretics is very important. Then fourth question, the pulse rate should be checked in patient receiving metoprolol. Metoprolol is used along with other medicines to treat high blood pressure, or we call it as a hypertension. This medicine is a beta blocker. This drug reduces the heart rate. It works by affecting the response to nerve impulse in certain parts of the body like the heart. As a result, the heart beats slower and decrease the blood pressure. When blood pressure is lower, the amount of blood and oxygen increase to the heart. So that is the action of the metoprolol. So the main function is to reduce the blood pressure, but also it reduces the heart rate. Same like digoxin, if we give to a patient who is already her heart rate is decreased, so the metoprolol will again decrease the heart rate. So it is preferable the patient should be assess the patient blood pressure and pulse should be at least above 60. Placing an eye patch on unconscious client is essential. Placing an eye patch on an unconscious client to maintain their ocular surface to prevent complications such as corneal abrasions, infection, ulceration, perforation and even blindness. Drying of the conjunctiva and cornea is the major problem, and adequate lubrication and proper eye closure is vital in a patient who is unconscious. The eye should be relubricated every 4 hours. Sorbitarate tablet for a patient with acute angina pain to be administered sublingually. This medication belongs to a class of drugs known as nitrates. It works by relaxing and widening the blood vessels so the blood can flow more easily to the heart. Therefore, it provides better blood and oxygen supply. Angina is an emergency condition. Treatment must be initiated immediately to provide relief and to improve the outcome. Using sorbitarate sublingually will let the medicine work immediately, faster and than ingesting normally, because under the tongue there is a increased blood flow is so superficial and these drugs will be easily absorbed than it taken orally. Head is elevated in a patient with increased intracranial pressure. Increased intracranial pressure can also due to a rise in pressure within the brain itself. This can be caused by a mass, just a tumor, bleeding into the brain or fluid around the brain or swelling within the brain itself. An increased intracranial pressure is a serious and life-threatening medical problem. In most patients with intracranial hypertension, head and trunk elevation up to 30 degrees is useful in helping to decrease ICP by providing that a safe cerebral perfusion of at least 70 mm of mercury or even 80 mm of mercury is maintained. Bleeding is a common manifestation of a patient with thrombocytopenia. A primary function of the platelets is to prevent and stop bleeding. If the blood vessel is damaged, the body sends signals to the platelets which cause them to travel to an injured area. Thrombocytopenia is a condition characterized by abnormally low levels of platelets, also known as thrombocytes. The other name for the platelets is thrombocyte. That is why it's called as thrombocytopenia in the blood. The bleeding results from unusually low levels of platelets because platelets play a major role in the coagulation by forming the clot. Unconscious patient is positioned in lateral recovery position. A person is unconscious but breathing and has no other life-threatening conditions. They should be placed in recovery position. In medical terms, the recovery position is called lateral recumbent position. Putting someone in the recovery position will keep their airway clear and open. It also ensures that any vomit or fluid won't cause them to choke, or it may not go into the respiratory system. That is why the unconscious patient is positioned in a lateral recovery position. Never elevate the chest tube drainage system to the level of patient chest. The chest drainage system must lower than the chest to facilitate drainage and prevent backflow. Keeping the drainage system below the level of patient chest enhances the gravity drainage. Additional pressure is created when the patient exhales or cough. However, the patient have a large air leak into the pleural space. Gravity drainage may not be sufficient to evacuate the chest and suction may be required. But in case if we elevate the chest tube drainage system above the level of patients, it may cause the backflow, and whatever fluid comes out, it may go inside the chest again and can cause infections and life-threatening complications to the patient. That is why we should never elevate the chest tube drainage system to the level of patient chest. Thank you. Thank you for listening. We will see you in the next session. Bye.